Hi, I'm Dr. Sankalp Singh. So many patients, they are requesting me and discussing with me regarding their worries about having an abnormal child born to them. So they have a worry in back of their mind that some of their family members, brothers, sisters, or somebody known to them had a genetically abnormal child, a special abilities child, and they are worried that they don't want to have such situation and whether there is any method to prevent it. Now, the genetics of the child comes from the genetics of the embryo, and the genetics of the embryo comes directly from the genetics of the egg and the sperm. So in such cases, one, we need to improve the quality of the eggs and the sperm by giving certain medication, by reducing the bad habits like smoking, and correcting whatever the problematic things are there which can lead to a genetic problem. The second thing is the actual testing of the embryo by the testing known as PGT or Pre-implantation Genetic Testing. So in this, we do the IVF process, make the embryos, take them to day 5, that is a blastocyst stage, and then take few cells out of those embryos. So a blastocyst usually has around 120 cells. So we take 5 to 10 cells out of it and do the genetic testing on those embryos. With these genetic testing, we'll come to know which embryo is normal, which embryo is abnormal. Then we select the normal embryos and put only the normal embryos, and we destroy or discard the abnormal embryos. That way we can prevent the risk which are there from IVF or in natural pregnancy from having a genetically abnormal child. Now, this particular technique is also used very well in other genetic conditions like thalassemia, because many of the couples which we treat are thalassemia carriers, both husband as well as wife. So in those couples, we screen them to know what kind of genetic mutation they have in their blood for thalassemia gene. Then we test the embryo for two things. One is we do the PGT testing, that is PGT-A, to check the all 23 pairs of chromosomes. And then we do the thalassemia testing, that is PGT-M, which is to check for all the thalassemia gene mutation which the husband and wife are carrying. And then we come to a pool of embryos which are normal by both PGT-A, that is they don't have a chromosomal abnormality, and they are normal by PGT-M, that is they don't have a thalassemia gene mutation. Then we take those embryos, and one of those embryos would be put into the uterus. That will give them a healthy child, both by chromosomal issues the child would be healthy, and by the thalassemia testing as well. So every month we do thalassemia testing for couples, and I think we would have done close to 200 plus couples who would have gone through this process and had a very healthy outcome. So in case you are looking for it, please don't hesitate, visit the doctor early, because the important factor here is that the earlier you do it, when the age of the wife is young, we'll get more eggs, we'll get more embryos, and there'll be a higher probability of us getting a chromosomally and thalassemia wise healthy embryo. So the time becomes very critical here. So the quicker you go, the faster you go, the better would be at the earliest possible time you'll get a result. All the best.